Motivational interviewing is a technique in which practitioners encourage their client to have a change in behavior that is not in their best interest. It can be any changeable aspect of life: substance abuse, nicotine addiction, physical inactivity, and also overeating. There are two main aims of motivational interviewing, in which the first one is to elicit patient own desire to change and to resolve ambivalence. So ambivalence is a natural condition in which patients are unsure about the changes, lead to feeling of doubt and also anxiety, and in the end, it will lead to procrastination. So there are four core skills of motivational interviewing, which is the O, A, R, and also the S. So the O is open-ended question. We let patient do most of the talking by asking question. A is affirmation. We give compliment, appreciation to the patient. So R is reflection. We rephrase patient word, and S is summarizing, which is a long reflection of patient story. So there are four processes of motivational interviewing, in which the first one is engaging, focusing, evoking, and also planning. So engaging is important to establish a mutual understanding and also good relationship between practitioner and also the client. And the second one is focusing. It is important to create a clear direction, goals, and also priority about the change. And the third one is evoking, to elicit patient own motivation to change. And last one is planning, to develop a specific change plan.
Let's see how we can apply motivational interviewing in a psychiatric condition. This subsequent scenario shows how a doctor deals with a patient with mood disorder, specifically bipolar mood disorder with aggressive behavior and violence. Let's go.
Hello, good morning, sir.
Good morning, doctor.
It's a pleasure to meet you. How are you today?
I'm feeling pretty fine, I guess.
But before that, I would like to introduce myself. So my name is Dr. Muhammad Amir, and I'm a medical officer in charge for today's clinic session. But first thing first, what will you do me to prefer you?
You can call me as Munir.
Okay, Cik Munir. I believe that you have something to share with me today. But before we begin, I just want to assure you that anything that we talk today is confidential. So would you that be okay with you?
Yeah, sure. I understand. That's fine.
Okay. Excellent, Cik Munir. So basically, may I know what brings you here today?
At this moment, the doctor is engaging with the patient by asking open-ended questions to build rapport with the patient. This is to ensure that the patient is more forthcoming with his issues.
I find myself kind of been getting messing up recently, and I got myself into a big trouble unintentionally.
I see. Can you tell me more about that?
Uh, you see, doctor, I think I have a relapse of my condition. I was previously diagnosed with bipolar type 1 mood disorder here in this hospital,
Okay.
and I was given some medication. I think you know that. And my symptom, actually, I find them getting worse, and it got me into trouble, and I felt bad about it.
I see, Munir. If you don't mind to share with me, can you tell me more specifically about the trouble that you get into?
Last week, I sorry, I'm nervous to
I
say
see.
this,
Take your time.
but I find myself getting easily angry, and I hurt the people I love. So I hit my wife. I hit my wife last week, and this was not the first time that I hit her, so I felt really bad about it.
I'm really sorry to hear that, Mr. Munir. I understand that you must have felt quite unhappy lately with yourself, considering what just happened, that you saw it get angry and irritable really quickly, causing you to unintentionally hurt the people that you love.
The doctor is focusing on the issue that is bothering the patient by doing a simple reflection. This shows that the doctor understands what the patient is thinking and feeling by saying it back to the patient.
But I just want to point out that the fact that you seek for treatment today is really a good initiative.
Now, the doctor is giving affirmation to the patient by acknowledging his efforts to seek treatment. This is helpful, especially in building the patient's sense of confidence.
If I may ask, why do you do that in the first place? Is there anything that is disturbing you at that moment? Can you elaborate more?
Last week, doctor, we planned to go out for a family dinner, but no one got ready on time. So I felt irritated, I felt agitated. It turned my frustration, it turned into anger, and I just start punching the wall. I punched the wall so hard, but it does not give me the relief I want. So I hate my wife because she's the one closest to me. I just need to vent out somehow. So I hate her, and I felt so bad because this was not the first time. I I can't keep doing this to her. She's my wife. I love her. I really need to change, doctor. I really do.
This is known as the change talk, in which the patient has stated his desire to change.
I see. So overall, you have a lot of things going on lately. I get the sense that you were really excited to spend time with your family, but it seems that they were not showing any interest. Because of that, you started to feel irritated and angry and started to hit your wife for a few times. And you also told me that this is not the first time you have done that, right?
The doctor is summarizing the patient's points to ensure that he gets the whole picture of the situation, as well as to show that he paid attention to his story.
Do you have any idea as to why you find easily irritable lately?
Well, doctor, actually, for the past few weeks, I have not been taking my medication as usual because I just think it's such a hassle. It's bothersome. I mean, I just want to live my life normally like everybody else. Why should I depend on drugs for me to just be normal? I mean, would you want to do that? So, but then I find myself like since then things sort of got out of control, and there's that situation, the trouble that I get. So I was thinking maybe it's because of the meds, but but, but should I take the meds?
At this point, we can see that the patient is being ambivalent, which is a state of unsure of change. He is now unsure whether to be compliant to his medication or not.
Yeah, I understand, Munir, but you did say that your situation is getting out of control since then. So how has not taking your medication regularly caused problem to you? So I just want to know, what is the worst thing that happened to you since then because of not taking the medication?
This is the process called evoking. Evoking is when we elicit the patient's own motivation for change. In this scenario, the doctor is using the extremes to evoke change talk, in which he asks what was the worst thing that has happened to you since then.
The worst thing that has happened. Well, I did I did got so irritated at times that I hurt my wife and my children on three separate occasions. I also behaved violently at my workplace and also with my colleagues until I was on the verge of getting fired. And my wife, she she actually asked for a divorce and custody of our children, but I don't want that. No, I don't want to live without them. I can't live without them, doctor. So that's why this time I need to set things straight, and I need to get things right so that I don't make decisions I'll regret later on.
It must have been difficult for you these past few weeks, as I can see that there have been a lot of things going on, and you do want to change and become better. Actually, Munir, I applaud your determination. I understand your feelings, and I also feel that your family and friends are very important to you. Talking about importance, Encik Munir, how important would it be to you to make change to your problem so far?
Oh, doctor, it's very important. I think that's the only thing I want to focus on as of right now.
Alright, so I can see that it's very important to you, and I also can see that there's a lot of good factor for you to start to change it for the better. But Munir, it is very hard to suddenly stop taking your medication altogether, because medication help to control your symptom and stabilize your mood. So you need to be compliant to your medication first, and a good news is that when you comply to your medication and your symptom become more stable, we can taper down your medication. Okay, so in view of that, would you be compliant to your medication?
No, doctor, now that you explain it in detail to me, I think that would really be helpful, and I would like to take my meds regularly now.
Munir, I can see that you are very keen for improvement and enthusiastic to change your behavior. fact, can we discuss more about how to manage your behavior and anger issue apart from being compliant to medication?
This is the process of planning. Now that the patient has made it clear that he is determined to change, we can start developing a change plan that the patient agrees and is willing to implement.
Yeah, sure, doctor. Let's go.
Okay, so from what I understand that the reason you stop taking your medication because you don't want to solely depend on your medication, right? So basically, Munir, there is other ways that can help you aside from taking the medication. So I just want to ask you, what do you think the best option for you to channel your anger and also your frustration?
I think for me, I love to do my favorite hobbies, which are painting and drawing.
I see.
Because when I do that, they sort of like relax me and sort of let me wind down a bit when I'm feeling stressed.
Yes, drawing and painting will be really wonderful, and I can see that you really enjoy doing them. Okay, so I just want to summarize our session for today. So, as an overall, you told me before that there is a lot of horrible things that have been happening to you, where you started to become more and more irritable, as well as become violent, where you started to hurt your family. And you also told me that your behavior also affected your relationship with your colleagues at the workplace, and this happened because you didn't comply to your medication at the first place. And this happened also because the relapse of your symptom and also causing changes in your behavior. And Munir also told me that it's very important for you to change everything. Yeah, you want to become a normal people like the other people. Okay, so in fact that you also come up with the best strategy, which by painting and drawing in order to wind out your anger and also your frustration. Does that sound correct to you?
Yeah, I guess that summarizes everything.
Okay, so if in that case, is there anything that you would like to ask me or clarify or anything?
No, Rata, I think you've been listening very well. Thank you so much.
Okay, thank you, Munir. It is very nice to meet you for today. Okay, thank you.
Thank you.
Let's recap on what we have learned about motivational interviewing so far. There are 4 core skills of motivational interviewing which can be simplified using OARS. O stands for open-ended question, A stands for affirmations, R stands for reflections, and S stands for summarizing. There are 4 fundamental processes in motivational interviewing, which are engaging, focusing, evoking, and planning. Thank you for watching our video. Till we meet again. Bye-bye.